Hello, my friend, supporter. Welcome to medical science class. As a student of medical science, I wanted to take you about everyone's of science of everything. So, that is the body knowledge that is there. So, that is good. As a knowledge, no one of the people. Now, my friend, this is what I am speaking. Yeah, I look now. Yellow shop, yellow motive. Another mostly shop, now, medical science. We discussed about disease like disease like dysentery. And the type of dysentery, I mean bacillary dysentery, and dysentery. How you identify dysentery? Dysentery. In case of bacillary dysentery, passing of stool more. The stool amount of stool more. Bacillary dysentery amount of stool more. Amoebic dysentery amount of stool less. In case of amoebic dysentery, that is copious. Bacillary dysentery, that is not copious. In case of amoebic dysentery, you feel pain around the umbilicus. Bacillary dysentery, there is a abdominal discomfort, pain, with food and pain. In case of bacillary dysentery, if not go to the treatment policy, there is a bacillary amoebic dysentery, there is a if go to the untreated, there is bleeding passing coming to the bleeding coming to the stool. How you identify bacillary dysentery and amoebic dysentery? Sometimes we don't know doctor give both treatment coverage. If there is confusion, amoebic or dysentery is still not taken, then azithromycin, metronidazole. But in case of bacillary dysentery treatment, in case of me, I treat the bacillary dysentery by ciprofloxacin, amoebic dysentery, metronidazole. In case of bacillary dysentery, amoebic dysentery. Then, in case of passing of stool, oral rehydration, saline. Oral rehydration, saline, ORS. How much passing of stool? That much. Now my tendons of that bacillary dysentery. What is the in case of what is diarrhea? Passing of stool more than 3 times. If that diarrhea occur by video cholera, salmonella, shigella, the treatment of choice case of me, I use ciprofloxacin. That covers the salmonella, shigella, vibrio cholerae bacteria. That is the reason in case of me, I treatment of choice ciprofloxacin. When somebody treatment of choice ciprofloxacin is given, then miracle. That is not miracle. That is medical science. Medical science, one dose in case of bacillary dysentery, ciprofloxacin after taking one dose, those are suffer. Take one dose or reduce amount. Then in case of amoebic dysentery, metronidazole one dose, oral dose. But if oral dose not remain, passing to the stool, then try to give an IV route. Ciprofloxacin IV route, and in case of bacillary dysentery, in case of amoebic dysentery, metronidazole IV route. And in case of cholera saline. But before that cholera, IV route given saline, you take the oral dehydration saline, ORS. And in case of cholera, ciprofloxacin is the treatment of choice. But in severe mode, in case of severe case, sometimes steroid can be used to severe stop. Steroid can be used, low amount, low dose, and now somebody say that is miracle. That is not miracle, that is medical science. By that medical science, when doctor are confused, either bacillary dysentery, amoebic dysentery, give 2 doses. Azithromycin, metronidazole combination. In case of azithromycin, 2 tape, 1 tape azithromycin and metronidazole stent. But in case of me, I give ciprofloxacin 500 milligram. In case of bacillary dysentery, ciprofloxacin 500 milligram, 1 tab stent. In case of amoebic dysentery, metronidazole 400 milligram, 1 tab stent. In case of cholera, ciprofloxacin 1 tab stent. If there is sensitivity of ciprofloxacin, then sensitivity, any reaction occur, stop that dose. Not only ciprofloxacin, any drug. If drug reaction occur, first stop that dose. Then that what drug you taken, that correct by normal physiological system, just to return. An antidote can be given. Try to understand drug overdose. Drug reaction. If in case of blood reaction, discuss about this class. Today, medical science. Now, in case of any drug, first dose of what is in case of my patient, first dose taken, after first take shown the symptom, what is the reason you come, that is reduced, the treatment protocol is there. If that is not reduced, the treatment protocol is not there. You go to the doctor and say that I have not feel better, still not. Already 1 tab or 1 dose taken. Already in case of oral route, IV route, injection taken, cannot feel better. And speak honestly. not take to after give and take. You feel better. If you say wrong, then doctor give to another. If you feel better, you say to feel better. If you not feel better, say to not feel better. Then doctor correct. And we all are creation. There is a misinterpretation, misdiagnosis. As usual, medical science is vast. That is the novel profession and vast. That is the reason. Thank you very much, my friend supporter. Today is an up from medical science class. I am representative of Dr. Manushri, Dr. Sohelc, MSC, representative of MSC. Today is an up from medical science.